This sounds too good to be true. What's the catch with teeth in 24 hours? Good question. There is no catch. This technique, all-on-X prosthetic, was designed in the late 90s, but Nuvia has taken all the advanced technology in dentistry and has just created a prosthetic using our strongest materials that we can use in dentistry to make this prosthetic within 24 hours after surgery. Okay, hard-hitting question here. How can people trust such a new process? So like I had mentioned before, it is not a new process. It's just the fact that Nuvia has taken all the technology that we can within dentistry. Year on year, we're adding additional technology. It's all for the patient to be able to get these teeth within 24 hours. Also, Nuvia has an A+ rating from the Better Business Bureau, and we've been awarded Dental Implant Restoration's Company of the Year by Healthcare Business Review 3 years in a row. Is Nuvia rushing the healing process? Short answer is no. So the healing process cannot be rushed. Nobody can rush the body. The body needs time to heal. Definitely not rushing it. We definitely respect the healing process. We're actually making the healing process better because we're providing additional cross-arch stabilization with a more rigid, stronger material. We're using the strongest materials possible in dentistry to make this prosthetic. And when you have strong materials holding everything in place, soft tissue, implants can heal undisturbed. The older version, you have additional materials, acrylic, which is essentially a hard plastic. With the acrylic prosthetic, you can have additional micro movement that can lead to implant complications or can possibly lead to implant failure. A good analogy is when you break a bone, would you rather heal in a sling or would you rather heal in a cast? When you break a bone, you wear a cast because you need that rigid protection to hold everything in place for the body to heal. How do you know if the implants are successful if the permanent teeth are placed in day one? That's a really good question. A lot of people think that because you're getting Nuvia permanent teeth in 24 hours, it's so long, see you later. It's not like that. We definitely do follow-up appointments, multiple follow-up appointments after getting the teeth. The most critical one is at the 4-month mark. We will take the prosthetic off and we will check the healing process of those implants, make sure they're integrated and healthy. Go over oral hygiene, make sure everything is good before we put the prosthetic back on and tighten everything and go from there. Is anyone a candidate? Unfortunately, no. Take that first step though. Take the Nuvia 60-second quiz so that you can see if you could be possible candidate. Will Nuvia's teeth cause a lisp or poor speech? Well, anything that goes in your mouth is going to cause a lisp or poor speech. If you have a night guard, if you have had a retainer, anything, you're going to see that your speech has changed a little bit. So the same thing goes with the Nuvia teeth or any other prosthetic. There is a transition period where you have to retrain your lips, your tongue, your cheeks with the prosthetic that is in your mouth. But like I said, a lot of patients will take maybe a couple weeks, maybe a couple months. If you read out loud, do carpool karaoke, that will speed up the process. Will Nuvia's teeth cause or worsen TMJ pain? Short answer is no. We'll make sure that clinically the prosthetic is an ideal occlusion and fit for each patient. And then we always do follow-up appointments to make sure that the patient is comfortably biting, chewing, functioning, and make sure that everything is in healthy, good order. What's the biggest change you've seen in a patient? That's probably the best part of the job, is seeing the full 180 change in patients' personalities. We have a lot of patients that come in, men specifically will have full facial hair blocking their lips, their teeth, and so that way they don't have to show their teeth. Or we have women that may have things, distractors like a lot of makeup or fancy hair, stuff like that, that will kind of try to divert attention away from their mouth. And so what we see is when we are able to deliver teeth in 24 hours, almost immediately these patients are able to smile with their permanent teeth and the personalities start to come out. You have a wallflower at consult, and now their true personality starts to come out immediately after getting the teeth. And then as we see them at the follow-up appointments, they're just a lot more chatty, smiling, able to go out and socialize. And that transition, I mean, that transformation is unbelievable and probably the best part of the job. Are Nuvia's teeth a one-size-fit-all? No. The second a patient steps into a Nuvia clinic at consult, we're taking photos, we are taking x-rays. All that information is digitized. We're sending it to our lab. Our providers are looking at it, and we're able to do digital design specifically for everybody's face. Everybody's face, mouth, everything is a little bit different. So everything is customized to each patient. So a lot of patients ask, what does this cost? That's very important because this is an investment in your health. And so they probably think, oh, Nuvia is very expensive. They use all the advanced technology. It's actually a misconception. Because we're able to create a very efficient system, the savings are passed on to the patient, and Nuvia is below the national average for this prosthetic. If you want more information, we're going to leave the cost guide in the comments below.